Aeneas, do you know anything about that?
I've heard some talk about it in the background. The Pepcid, first of all, that's given IV, it is not your store-bought stuff, but the chemical is the same. And the dosing
Any benefit then from taking it, sir? Any benefit from taking it?
At this point, again, I don't see any benefit at this point, although unlike some other remedies like hydroxychloroquine that definitely have known risks, Pepcid's a pretty safe drug. I still would not advocate it at this time. What they're talking about is like 9 times the regular daily dose and seeing if that has an effect.
Dr. Gibson, I'm interested in hearing more about like maybe what you find most promising at this point.
Most promising, I think, is really that this virus is teaching us in a way that it's making all of us, I think, more humble in realizing that our first interventions really weren't necessarily the best. And I think that's why you're seeing a whole lot of downstream effects, like people getting on ventilators. You don't hear about them coming off. And we're learning now that the best treatment is to avoid putting people on the ventilator if at all possible. Before this crisis, we would have said, oh, it's a support. You give them the ventilator as soon as they're showing signs of fatigue. Here, we know if we do that, we put them into a higher risk category, and that if it's humanly possible to avoid, you do that, and that's the best care for the patient. So they're treatment like that. Also, we were treating patients with diuretics right off, and we were seeing a lot of kidney failure. We're now learning that, well, these patients, we give them fluid, which normally you wouldn't necessarily do right after a lung injury from a viral infection. So we're learning. It's not dramatic, miracle cures, but we're learning how to avoid some of these downstream injuries that we were just going, straight into when this started.
Yeah.
Dr. Bruce Gibson, thank you so much for sharing that information with us today, and we appreciate all that you're doing to help patients. Well, turning now to the battle brewing among Democrats, hoping to take on the president in November. Let's check in with our man with his ear to the ground, our very own John Gizzi. John?
Hi, Karina, and hi, Bob.